So what is medication-assisted treatment? Medication-assisted treatment, or MAT, is the use of approved medications that have been studied, along with counseling and behavioral therapies, to take a whole person approach to the treatment of opioid use disorder. MAT may also be known as medically assisted treatment, or you may hear the term medications for opioid use disorder, or MOUD. These are all referring to the same thing. So why would we want to use medication-assisted treatment, or MAT? Studies show that use of MAT reduces opioid use, reduces opioid overdose deaths, decreases criminal activity, decreases infectious disease transmission, and also saves money. In addition, it improves social functioning, retention in treatment for substance use disorder, and a person's ability to access much-needed counseling and behavioral health services. It's what we call a harm reduction strategy. Harm reduction works to minimize the harmful effects of drugs rather than ignoring or condemning them. And it is important as we talk about this that you remember that opioid use disorder, OUD, is not self-limiting, meaning it stops on its own. It's not a choice or moral failing. It's not managed acutely, meaning we don't just treat it one time and it's gone. And it's not discriminatory, meaning it can happen to anyone. Opioid use disorder is a chronic, relapsing, or recurring medical condition like diabetes, hypertension, and asthma. And it's a response to physiologic changes in the brain, meaning what your brain's made up of changes. It's treatable, and it's often long-term treatment, and it's inclusive, meaning it can happen to anyone. So this is a little bit of a complicated slide, but I want to show you how these medications actually work in the brain. So up here we have an empty opioid receptor. A receptor is something in our bodies that gets activated when a medication binds to it. So these opioid receptors sit in your brain, and that's where opioids such as pain pills like oxycodone or illicit opioids like heroin act. So there are 3 approved medications for medication-assisted treatment. One is methadone. Methadone binds to that opioid receptor in the brain and has a full effect on the brain like another opioid. The other one is buprenorphine, or you may have heard of Suboxone or Subutex. Buprenorphine binds to that opioid receptor and it causes a partial effect. And finally, our third medication is called naltrexone. And naltrexone binds to the receptor and it blocks it. So you have full activity, partial activity, or you block that opioid receptor completely. In the rest of the presentation, I'm going to primarily focus on the methadone and the buprenorphine, as those are the ones that folks often have the most questions and misconceptions about. Here's a great quote from a physician. "We tell our patients that this, medication-assisted treatment, this is your insulin. This is your blood pressure medication. This is helping your brain function." And I think it's important to think about this. This is a medication for opioid use disorder, just like insulin treats diabetes. So why medication-assisted treatment? So let's talk about how this works. Over here we have your mood, and this is time. So when someone uses a substance like heroin over time, initially they get high or feel euphoric, and then when the effect wears off, their mood decreases and moves into dysphoria or feeling bad. And over time, when someone becomes dependent on a substance, their brain actually changes to the point where they're hanging out down here in this dysphoria or bad feeling all the time, and the only time they feel okay and can function is when they're using. So at this point, they're not using to get high, like maybe they did the first time. They're using to feel normal. Their brain requires this. It's dependent on it. And that's how MAT can help. With methadone or buprenorphine, you can move from this dysphoric place, this bad feelings, withdrawal and feeling awful, to feeling normal, which allows people to function and get the rest of the services they need to recover. Here are just some experiences of folks who have used medication-assisted treatment. My son got his mom back. I've repaired relationships. I have a job and I've kept it. I can pay my bills. Just a few examples of how this can be life-changing when people finally get the treatment that they need. Next, I want to address some common misunderstandings about medication-assisted treatment. The first one is, can it be used in pregnancy and lactation? And the answer is absolutely yes. There are benefits for both the mom and for the fetus. The benefits for the mom is that it reduces overdose and death. It decreases the mom's risk of infections and increases engagement in prenatal care and recovery treatment. And for the fetus, it reduces those highs and low levels of the substance that, for example, if someone continued to use heroin and went into withdrawal, which is hard and stressful for the fetus, it decreases loss of the fetus and also decreases preterm delivery. So absolutely, MAT can and should be used in pregnancy and lactation when appropriate. But wait, are people on this forever? Shouldn't they taper off? Isn't this just substituting one thing for another? And the answer is no, it's really not the goal for people to taper off of MAT. Why is that? How could that be? It's because people that have opioid use disorder are at very high risk of relapse and overdose. And we can't tell if you go off, even if you've been stable for many years, if you go off, if you'll be one of the people that actually overdoses or relapses off of treatment. So that's not the goal unless it's the individual's goal. And that would be later on in treatment when a lot of other structures are in place to support their recovery. And it's important to remember, again, that opioid use disorder, or OUD, is a chronic, recurrent condition. So like with your blood pressure medicine, once your blood pressure is at goal, you don't stop the blood pressure medicine, you keep using it. Although there are some people, like with blood pressure, that they can manage it without medications, but that's not everybody. And many people do need a medication as well. But don't people just abuse and divert buprenorphine, for example? Well, sometimes is the true answer, right? Some people misuse substances or divert them, and by divert, I mean giving or selling the medication to somebody else. So that does happen. Although it's hard to identify how often this happens, it's often altruistic, meaning someone may give or sell their buprenorphine to somebody else to help them not go into withdrawal because they're dependent on, for example, heroin. There are a lot of strategies that we use to minimize misuse and diversion. We limit the amount that people can have at a time. We have them come in and count to make sure they have the right number of pills, and we can screen their urine to make sure that they're using the appropriate medications. So it's possible, but perhaps not as likely as people think. I think it's so important for you now to know the MAT facts, that it reduces opioid use, reduces death and criminal activity, reduces infection and saves money, improves social functioning, allows people to be retained in their treatment activities, and it increases people's ability to access much needed counseling and behavioral health services. A harm reduction approach.